testimonials to move something. So, and then international activism. There are the international politics of health freedom is extremely active and complicated. And the European Union has a traditional herbal medicines directive, so they have to get licensing in order to use the herbs. They're not like us. Like in the United States, now we have this presumption that an herb is actually a food. It's in the Dietary Supplement Act. And the government has to prove it's dangerous before they take it off the shelf. So the burden of proof is on the government to show harm. In Europe, they have to get permission first to let the government gives out the right to use that herb. So we're extremely grateful and protective of herbs and dietary supplements as presumed to be generally regarded as safe with the government's burden of proof. And we're going to fight to keep that. They also have a food supplements directive. And in their food supplements directive, not just herbs, it's still a positive list. Like, here, we're the government, we will let you use these things instead of the United States protocol. In Canada, they have now the natural therapeutic products. So if you're using something for therapeutic reasons, even if it's food, you've got to go through the regulatory process. That is the same thing that Europe, Australia is looking at. Australia tried to take their laws that are positive list oriented, therapeutic oriented, and they tried to make New Zealand harmonize with their laws. And New Zealand has put up an incredible fight and has overturned the harmonization. And now New Zealand's working on drafting their own freedom type of dietary supplement product law, except that they worked for 4 years, they worked with the industry, they did all this wonderful work, they submitted it, and immediately it was converted. That whole bill was taken and replaced with an Australia type law. And so we're working to get that back to the original draft. But you know, these are small people. I mean, they're important people in the politics of New Zealand, but they're not massively, you know, they're not like the amount of energy that is behind the industry. So another comment about Codex, the issue that I want to bring up to you is who is representing you. And that's the part that I want to encourage you to think about. Do you belong to a health freedom or a political organization? Do you belong to a school, you know, parent group? Do you belong to a county commission? Do you go to public hearings in your town? Do you know if there's a smart meter in your basement? Do you know if fluoride's in your water? You know, these are really important things for you as people to be involved with. And we have, in my estimation, a sleeping country of people. We have a country that has people in it that utilize the advantages of the freedoms, but that they don't spend much of their day protecting them. So we have developed in our organization, we thought it was important to get all these leaders together that are doing the leading organizations, like the vaccine leaders that have a lot of consumers in their organization, or the Citizens for Health that works on the dietary supplement protection, or the COMED that tries to get mercury out of our medicines. And so what we did is we brought all these leaders together and formed our own little Congress, and we have started to, this is the first one we had in 2006. These were the organizations that came around that table to build resolutions, and we actually worked for a whole day at designing an international health freedom declaration for ourselves. And we're wanting to move health freedom as an issue for the people to help the people survive so that it does not get dominated by drugs. So, we're building brick by brick. If you can participate, one of the things that we're going to do is we're going to have a Health Freedom Congress in Chicago, June 5th and 6th. And we have 40 organizations that we're inviting to sit around the table. And if you want to come and observe that Congress, you may. And there's a Health Freedom Awards banquet. And we're going to work at strategizing how to build the strength of the health freedom movement. And before, as we started this, the groups were individual. Like people would be working on dietary supplements, or they'd be working on mercury toxicity, or they'd be working on children vaccines or chemotherapy. And these issues are all very important. But the people, you, I, are coming at this in a more integrative approach, because I want to get the root canals out of my mouth, and I want to have fluoride out of my water, and I don't want a smart meter, and I want labeling on GMO foods. So the people have all these issues in their body that are important to them as individuals. And we want that Congress to be reflecting all these issues coming from different aspects, and having these leaders know each other. Who's the go-to people? How many citizens do you have in your group? How can we mobilize and take on an issue? How do we get, fluoride out of the public water supply? I mean, South Dakota, they put in a bill. We're not having fluoride, and everybody should have been in South Dakota to pass that bill, and it died, But that's what's happening. We need more power at the capitals when we're making laws. So I have developed the principles of health freedom over a period of 5 years, and we had the Congress also discuss them. So I'd like to share those principles of health freedom with you today before I end and say goodbye. Oh, certainly. Am I going to speak in a panel discussion at 3 o'clock? I'm not sure if I am. I'm sorry. I just came in from Minnesota, so I'm going where I need to. But if I am, I'll be there. And if otherwise, I'll be in the audience asking great questions. How does that sound? Okay. So, principle number 1. The fundamental right of self-determination of individuals to be let alone to survive on their own terms and in their own manner. Yesterday, I was just on a telephone call with an attorney and an aging woman, and they're talking about guardianship, and the mom doesn't want to have invasive things, the elderly doesn't want to have invasive things, she just wants to do her life. And the kids are going crazy because the children want to help make that decision. Well, in our country, we get to decide what we do with our body. Adults, you can walk away. It's like Attorney Murray says, if you have cancer and you want to go home and sit in your rocking chair and look out the window, you may. That's just what it's like. So we want to protect the self-determination. And if you want to go to an alternative person or have herbs or whatever you want to do, that's your decision. Secondly, the freedom to perceive and act as one wishes to secure health. So you can speak freely, move about, go find a practitioner. You don't have to get shut down for the farmer coming up with his truck and raw milk. You can meditate, you can honor who you want, you can believe in different things. Some people don't believe in homeopathy. Some people don't believe in things that they can't see. They have to have different perspectives. You can practice the healing arts. Principle 3, the freedom to access. Now this is an important one because our laws have always been thought of as who gets to do what. But you should be able to access clean water. You should be able to access clean air. Or an herbalist. You should be able to access. And no matter how those are regulated, the government should not make a law that blocks you from something that you really think will help your health. Okay, but freedom does not come without responsibility. So if we all just did whatever we wanted, and there was harm going on, that would not be okay. So we do have the responsibility to do no harm to each other. Not to ourselves, we can do what we want, but to each other. So the community of do no harm is really important. When you live in community, it's complicated. And that's why freedom is complicated, or this experiment of the United States would have worked a long time ago. It just gets complicated. The responsibility to respectfully tolerate diverse options in health, healing, and survival choices is important. Now, if you don't want to respect somebody doing something else, like what kind of clothes you wear, but when it comes to a survival issue and a person has a particular belief or need to help themselves survive, we have to respect. Traditional cultural healing practices are varied throughout the world, and we have learned those cultural traditional practices because of survival issues. My time is almost up, so I'm going to wrap up. Principle number 6, the duties of corporations and institutions to be trustworthy entities upholding these health freedom rights. And along with that, we have special principles for corporations. My favorite one is this one. Avoid the promotion of products, protocols, policies, regulations, or laws that would encourage unlimited dependence on corporations and institutions, or that would discourage, prohibit, or otherwise negatively impact the ability or the will of humans and local human communities to survive and prosper without the corporate institution. For example, the GMO issue, very big on seeds. And my last principle of health freedom, the duty of the government to protect health freedom and to make no law or public policy abridging these health freedoms or its fundamental principles. Thank you so much. And I'll take questions after we